One of the more common issues that I see in treating foot and ankle problems is heel pain. Heel pain can occur suddenly on a moment's notice, or it can develop insidiously over days or weeks and months. But when a patient finally arrives at the office, they indeed have substantial pain that usually limits their daily activities. When a person does complain of heel pain, it can be located in several different areas. More uncommonly, it's at the tip of the heel where the Achilles inserts. But more commonly, it's in the area on the undersurface of the heel bone where the plantar fascia inserts. Even though it can be a large area of inflammation, it appears that this medial border of the heel bone is the most common area of pain. It's on the undersurface right below the calcaneus, and that's why I think if we look at a model, we can understand a little bit about the architecture and the pathology that occurs here. As we look at this model of the ankle joint, I want you to get oriented. This is the ankle joint itself, and then as we turn it, we can see the undersurface of the heel bone, or the calcaneus, and it's then this curvature area that the plantar fascia inserts. Now, this is a simplistic model, but it does show you how it works, and the fact that it's on the bottom, it inserts in the heel, and then runs all the way out to the tips of the toes, and it's a triangular-shaped object that is actually fairly dynamic. When one steps down, the arch sinks, and this tightens, stretching the plantar fascia, and it can cause the development of pain and inflammation in this region, and that's commonly the area where you experience heel pain with plantar fasciitis. This is a nice schematic diagram demonstrating the attachment of the plantar fascia to the heel bone and how it courses all the way along the bottom of the foot out to the toes, so that when you stand in the morning and stretch that plantar fascia, you put tension on its insertion in the heel, and that's why you may develop heel pain. Frequently, when you visit your physician, an x-ray will be obtained to look at the structure of your foot and especially your heel. When we look at the heel bone, we're looking for any signs of abnormalities such as infection, a stress fracture, or maybe even a heel spur. Heel spurs come in all shapes and sizes, and I'm going to show you some x-rays of different sizes of spurs. Our first x-ray shows a normal heel with no spur at all. Our next x-ray shows the tiniest of spurs that's present in someone with heel pain. Another x-ray is just a little bit larger, and the following x-ray, now it's getting pretty large, and my final x-ray demonstrates a huge heel spur. What's interesting is that the size of the heel spur really has no pertinence to the amount of pain that someone experiences. You can have someone with no heel spur and terrible pain, or someone with a large heel spur and no pain at all. We can't really explain that, but I can tell you that there's some things that are important to appreciate. In this diagram that I'm showing you, you can see that the heel spur is really a structure that you don't walk on. The red arrow shows the fact that the heel spur is a little bit in front of the weight-bearing area in the heel. There are other causes of heel pain besides just plantar fasciitis. There could be a narrowing or thinning of the fat pad, as we see in this diagram, and sometimes there can be an entrapped nerve that can cause pain in the region of the bottom of the foot as well. So these are all things that your treating physician is going to consider when he takes an x-ray, takes your history, and examines you. Another cause of heel pain that has to be considered in your evaluation is inflammatory arthritis. Patients may present with all kinds of aches and pains, and we have to think about rheumatoid arthritis, ankylosing spondylitis, gout, and other types of inflammation that can occur in and around the body. So from time to time, we order different lab tests, such as a blood count, a sedimentation rate, or a uric acid level, looking for inflammatory arthritis. But one of the most common causes of heel pain in adults is being overweight. It's interesting that when I look at the literature of heel pain, it's typically an American disease. We're big people here in America. We tend to weigh a lot. Because of that, when you look at our arch and when we step down it, like I showed you in the model, that curved arch tends to stretch out. And as it does, the plantar fascia stretches and sometimes tears a little bit. We don't see the heel pain syndrome, as I've explained to you, in the slightly built Asian population. In general, smaller people don't get this. So I guess really in America, we've got a corner on the market on heel pain. So when we get into our treatment plan, what we're after is the cooperation of the patient in trying to get their weight down a bit, because that's obviously one of the causes of the problem. Now, it doesn't mean that if you go out and you lose 20 pounds that your heel pain will automatically disappear. Usually heel pain takes many months to occur, and for it to disappear, even though one loses weight, it may take many months and other conservative methods that we'll talk about now and how we can effectively treat this problem. Probably 80 to 90% of heel pain can be treated successfully with conservative or non-surgical treatments. Really, about when one thinks about it, I feel that surgery is very uncommon for the patient with heel pain, but it does require a concerted effort to really do the things that we will suggest. It's interesting, over the last maybe 20 years of my practice, I've tried a lot of different things, and I tended to discard the things that didn't work at all and to include the things that really I thought had a good chance of reducing heel pain. Obviously, one of the things that helps is an anti-inflammatory medication. This can be an over-the-counter preparation or can be a prescribed anti-inflammatory medication. It's really up to you. But concomitantly with this is getting out and exercising to help lose weight. When you go out, you should try to briskly walk, or at least try to get up to a mile or so a day. That may be difficult to begin with, but an anti-inflammatory medication usually will help. It makes it not quite so painful as you exercise. The first few days may be a little tough. Another device that we commonly use is a heel pad. These viscoelastic heel pads are very soft, and when people are out walking, placing this beneath their heel as they exercise, this can cushion the heel, and such a device can often reduce their pain as they try to stretch their plantar fascia and exercise more. The more common complaints of heel pain seem to be associated with getting up from a chair after sitting for an hour or two, or getting up in the morning after sleeping and stretching the foot and feeling the immediate onset of heel pain. That's because when you sleep, you don't sleep with your foot in an upward position, you sleep with it in a downward position. Then when you step out of bed and stretch the plantar fascia and Achilles, you stretch your whole foot and you develop pain. Likewise, when you sit in a chair, you don't sit like this, you sit with your foot down. Then when you get up, you put the same kind of stretch on and you develop pain in the heel region as well. That's the typical complaint of people with plantar fascia, is getting up from a chair or getting up in the morning and developing heel pain immediately. One of the most effective treatments for heel pain is a nighttime splint. We've found that by keeping the foot at a little more than a 90-degree angle here, we'll keep it stretched, we'll keep the plantar fascia stretched. In a review in which we talked to a large number of our patients, we found that what they thought was the most effective treatment was this nighttime splint to decrease their heel pain. In the conservative treatment of heel pain, stretching exercises are extremely helpful in reducing symptoms of pain. Squatting at a counter and attempting to kneel down, stretching out the heel cord and plantar fascia can be very effective. Using a stretching block and just leaning against the wall can put the heel cord and plantar fascia on stretch that can be very effective in helping to alleviate the symptoms of plantar fascia. Although not a first choice, sometimes an injection of xylocaine and a corticosteroid into the region of the plantar fascia will help reduce pain as well. It's also been shown in the literature that 65% of heel pain can be effectively treated with a short leg or below knee walking cast. Therefore, using a cast, while not a first-line treatment, may be used if some of these other treatments, such as night splints and heel pads, are unsuccessful. Although 80 to 90% of heel pain can usually be treated conservatively and successfully, sometimes there are some recalcitrant cases that just don't get better with all the things I've talked about. And then some other modalities might be considered. One of the things that we found very effective here at our St. Alphonsus Foot and Ankle Clinic is the use of laser treatment. Though cold laser has only been used for maybe the last 3 or 4 years, the FDA study that we led here in Boise showed that probably 85% of those very tough cases could be improved significantly with the use of laser treatments twice a week for 3 to 4 weeks. Another choice is what we call Tinex, which is a small probe that we use surgically when the patient's asleep to try to eradicate the areas of inflammation. It's a small incision technique that has been found to be very effective in certain cases. And lastly, if none of these things are either in your choice of procedures or are contraindicated, or you just have a recalcitrant case, it may come to an open procedure where the nerves that I showed you may be explored and the plantar fascia may be partially released to relieve your pain. The recovery process for these procedures varies anywhere from a couple of weeks to maybe 6 to 8 weeks for the postoperative course. So what I've tried to do in this brief discussion is talk to you about the causes of heel pain, the many conservative things that you can do to try to alleviate your pain, and when you're one of those few that things just don't get better with time, the surgical choices that may be available to help you get better. It takes patience to get over heel pain. This problem may have resulted over a period of 3 or 6 or 9 months, and it may take a similar period of time using these conservative methods to eradicate the pain that you feel with every step. Staying active means staying healthy. Sometimes heel pain can slow one down and really inhibit some of the activities that promote a healthy lifestyle. By trying some of the methods that we've discussed here today, I think the road to a happy and healthy life is right ahead.